A consultant brought into La Crosse this week has an ambitious goal for the area to end homelessness within 1 year. She repeated that message today at a public meeting about the issue. News 8's Madeline O'Neill was there and joins us now with more.
Mike, there are about 1,300 homeless people in the area, and the community came out today in full force to see what can be done about it. The meeting was packed, and it's that kind of spirit of helpfulness and willingness to work together that the consultant Erin Healy says will bring real change.
La Crosse has an incredibly vibrant, compassionate, smart provider community around homelessness. And as evidenced today by the crowd that showed up for this talk, people want to do something.
There was very little standing room, let alone sitting room, at this public meeting addressing homelessness.
A lot of homeless people in this community look like you and me. They have jobs, they have families, but they don't have a home.
The longer you are homeless and nowhere to sleep, nowhere to shower, go to the bathroom, get food, your mental health starts to destabilize along with your physical health.
National expert Erin Healy has been brought on as a consultant to build upon existing efforts in the area.
There are a lot of good people with great intentions in the community doing a lot to try and address homelessness, but I think our effort is to take a more coordinated, integrated approach.
Healy says collaboration is the name of the game.
Unless you have one goal that you're sharing publicly together, people don't really start to work as a team and as an overall system. So collaborating so that each agency can bring its strength and its particular resource to the table exactly when it's needed.
According to Healy, working together towards effective solutions like permanent housing can make a big difference. And it makes financial sense as well.
It costs $14,000 to fund one emergency shelter bed in La Crosse, and using a median income measure, you could pay for 2 one-bedroom apartments for a year with that money.
And setting lofty goals like ending homelessness in a year can set a fire under the community to accomplish more than they thought possible.
Absolutely, and that's where we're headed.
From my experience, I know that La Crosse can end homelessness.
The meeting was held at the Franciscan Sisters St. Rose Convent and sponsored by Gunderson Health System's Office of Population and Health. Various organizations and officials joined in for the conversation.
Okay, thanks a lot, Maddie. The consultant will go through all of the information she's gathered this week and then present her recommendations and observations to the groups addressing homelessness in that area. It will then be up to them to implement any of those recommendations.